The Minister.
Thank you very much. Kincord, I don't intend to speak on this for long because we obviously spoke on this at great length at the committee and great length on many other occasions as well. I do just think people need to be very careful with the use of language. I heard the reference to abortion as a woman taking the easy option. I think that's grossly offensive regardless of anybody's view on the issue. It's never easy. No woman gets up and says, God, I'd love to have an abortion today. And I think that sort of language really actually adds to the stigma to women in crisis. And I think we should be careful when we're using that. It's not an easy option. Look, informed consent exists. It exists in this country. And if doctors don't follow informed consent, they can face the most serious of consequences, including losing their livelihood. There is a guide, one we discussed at great length, the Guide to Professional Conduct and Ethics for Registered Medical Practitioners. It is the Medical Council book. And it actually dedicates 5 pages to the issue of consent. Section 9, Consent General Principles. Section 10, Capacity to Consent. Section 11, Information for Patients. Section 12, Timing of the Consent Process. Section 13, Responsibility for Seeking Consent. Section 14, Emergency Situations. 15, Refusal of Treatment. 16, Advanced Healthcare Planner Directive. 17, Consent to Genetic Testing. 18, Children and Young People in relation to consent. And then 19, Personal Relationships with Patients. Page 15 to page 20 of the Medical Council Rulebook outlines the issue of consent. So the idea in this amendment that we need to tell a doctor that they must provide medically accurate information to a patient, that they must tell them the proposed termination of pregnancy, a method and the immediate and long-term medical risk, that's already standard medical practice. It's absolutely standard medical practice. So there's absolutely no need for this. I do want to, Kincord, just address one issue, because people keep on saying, what supports are you providing for women in crisis who don't wish to pursue a termination? And Deputy Fitzpatrick, and the reason I don't come back on this is it is report stage and we're only meant to actually stick to the amendments, so that's what I've been endeavouring to do. But in the interest of this, and whilst I'm on my feet this one occasion and one only, I'll expand from that. In relation to the 24/7 helpline, which Deputy Collins horrifically described as an advertisement line for abortion providers, which is just quite a disgusting thing to refer to it as well as being inaccurate. This is actually a non-directional helpline, Deputy Fitzpatrick. So your constituent, and there are many of your constituents who found themselves in crisis pregnancy and travelled to Britain and the Netherlands and abroad, or took the abortion pills last year and next year, and your constituents who voted by significant majority to repeal the 8th Amendment for us to pass this law. They actually can ring that 24/7 helpline, which will be operated by healthcare professionals who will provide non-directive information. That means all of the options. All of the options. Now, there's some people in this House who don't want one of those options to be termination. That's fine, that's your decision, you lost the referendum. But everybody else in this House wants that to be one of the options because we take our mandate from the people. So the non-directional 24/7 helpline is not an abortion helpline, Deputy Collins. It's a helpline, 24/7, that a woman in crisis rings. It gets all of her options, including access to counselling. Because Deputy Fitzpatrick is right. Access to counselling and supports for whatever decision a woman makes is important. And it's not for me, and I quite frankly don't think it's for anyone else, to judge the decision that that woman makes. I do disagree with you substantially on the issue of contraception. Contraception, by its very nature, reduces pregnancy. Contraception, therefore, by its very nature, reduces crisis pregnancy. So contraception can play a major role. We're increasing the amount of barrier contraception available in 2019, and I look forward to returning to this House with legislation to expand eligibility to free contraception for women. I've asked my department to do a body of work on that in terms of clinical guidance, and I hope that members of this House, particularly those who don't support this legislation, will support expanding eligibility to free contraception to more women in this country, so we can reduce the number of women in crisis pregnancy. So just to be clear, I don't intend to accept this amendment. It's very similar to the one put forward at committee stage. I think the DVD is gone, but it is similar other than that. The issue of consent is addressed in, but yeah, the offer of a DVD is gone too. Oh, sorry, I accept that too. The issue, I accept that's the difference too, Deputy Tobin, in fairness to you. The issue of consent is addressed in section 23, which clearly sets out the provisions of the bill will operate within the existing legal provisions. And I do have to say, because I've heard people say it once, I've heard them say it twice, I've heard them say it 3 times, consent doesn't exist on the statute books. That's factually incorrect. 1997, Non-Fatal Offences Against the Person Act deals with the issue of consent. So can we stop saying that the issue of consent doesn't exist on statute? It exists in primary legislation passed by this Oireachtas. Some of you were probably members of the Oireachtas in 1997 who passed that piece of legislation. It does exist in legislation. What you're asking us to do is say that abortion is so substantially different to all other healthcare provisions that therefore there must be extra obligations in law on doctors. My position is that termination of pregnancy should be integrated as part of a modern healthcare system for women, and that the same obligations, absolutely the same obligations, should apply to doctors, no less and no more. As I've already said, not only have we got the Medical Council Guide to Professional Conduct and Ethics for Registered Medical Practitioners, not only do we have the Non-Fatal Offences Against the Persons Act, we also have the HSE's National Consent Policy, which deals very much with informed consent. So I really don't believe this amendment. I don't question your bona fides. I really don't believe it's necessary, and I don't believe it has any place in this legislation.